Hey everyone, Dr. Cody Scharf here, owner of Thrive Spine and Sport in Cedar Rapids.
Here, Dmitry, Altshul, owner of Cedar Rapids CrossFit here in Cedar Rapids.
We're back today with part 3 of our 5-part series on our CrossFit checklist. Today we're going to be talking about the shoulder. Okay, so the shoulder is not really all that restrictive in the front rack position like Dmitry will show us here. So there's not a lot of stretch going on into the shoulder joint here. But what we'll be focusing on today is the overhead position. So in the position like the clean and jerk or the end position of the snatch. So as you can see in this overhead position here, the shoulder is going to be a lot more restrictive than what it would be in the front rack position. Okay, so to start the assessment, it's a very simple test to assess the shoulders. What you're going to do is you're going to stand upright. You're going to bring the arms up overhead as close to the ear as possible. Now, a normal range of motion with this should be the arm should be touching the ear, the upper arm should be touching the ear, or it should be within an inch away from it. As you can see here, Dmitry has a deficit on the right side, and he does have a right shoulder issue. The second part to this assessment is a side assessment. So we'll have Dmitry turn to the side here, bring the arms up overhead. Now this isn't too bad actually. What you should notice from the side is that the arms completely cover the ear.
Okay guys, we'll give you a couple tools that you could use to improve that shoulder mobility. So you saw that my right shoulder didn't have as good a range of motion. So the first thing we're going to do is just kind of work the back of your ribs on your back to help with that overhead mobility. What you're going to do is you're going to take a ball and you're going to place that ball, lacrosse ball, between your spine and your shoulder blade right here in the upper rib. What we're going to do is you're going to hop on the floor. We're going to place that ball right there, and you're going to move your arm back, keep it as close to your ear as possible, trying to capture that tissue. You'll feel like your ribs are getting pushed down each time you go back. And you just want to work this for several minutes over and over again, okay? The part 2 to this is all these muscles around your scapula getting stuck. So we want to loosen them up and smash them up. So what I like to do for that is first start right underneath your armpit where your lat bone right here ends, and just simply roll to the side on top of the ball and start pushing that tissue towards the bone until you feel like there's no adhesions there, there's no pain. You can comfortably smash those muscles. Once that occurs for several minutes, you can continue around your scapula and smash right around that bone, right around the perimeter of that bone. Same thing, working out any adhesions or any spots that might be sore. It may take you 10 minutes even to work that out until it feels smooth.
Okay, so what we wanted to show you is an actual post test after having Dmitry go through the mobility drills that he just explained. So go ahead, bring the arms up to the ears again. Now you can obviously tell that the right side is much closer to his ear than it was previously. And go ahead and turn to the side. And it's in a much better position than it was on the pre-test.
Okay guys, if you're looking to further improve your CrossFit movements, look for our seminar to improve your movement, to improve your mobility. All the details are in the blog below. I suggest that you guys sign up. There's limited spots so you can get better at CrossFit. And if you have any questions, shoot me an email at Dmitry, D-M-I-T-R-Y, at cedarrapidscrossfit.com or check out our website, cedarrapidscrossfit.com.
It's also important to note, as always, that as you're doing these mobility drills and retesting these assessments, if you're failing to notice any kind of noticeable improvements or changes, or you're still experiencing some pain, to seek the help of a medical expert. If you're in the Cedar Rapids area, I hope that you would choose my office. You can give us a call at the office at 319-423-0925, or you can give me an email, shoot me an email at dr.cody, C-O-D-Y, @thrivespineandsport.com. Thanks for watching.